this is Joe with Grandview Aesthetics and Jiva Med Spa. Today I'm here with Cassie, and we're here to talk about laser hair removal, also known laser hair reduction. So, how long have you been doing laser hair reduction?
So I've had my license for almost 3 years, so I've been pretty busy.
And why is the different names, reduction or removal?
So with reduction, we don't want to guarantee permanent hair removal. I mean, electrolysis is permanent hair removal. So for laser, you get that permanent reduction because we'll do 8 to 12 treatments and we'll get you in here about every 6 weeks. So we go over that hair. Every hair is in a different cycle. So typically, you get really good results from 8 to 12. Some patients need more, and that's just with their hormones and their hair. So we don't like to guarantee removal, but reduction, you definitely see that reduction with the hair. It's pretty patchy after a few treatments, comes in a lot thinner, you have to shave a lot less. So.
And how long does a treatment take, say, to do someone's underarms?
About 5 minutes or so.
Oh,
yeah.
That's fast.
Yeah, it covers about like 30 hairs at a time, kind of like a quarter size of hair.
And how about a full body?
Usually, depends on the person, typically about an hour and a half. We do, some patients want head to toe, like literally everything. Some patients just, want specific areas, but typically about an hour and a half. Mm-hmm.
And you can do underarms, face, basically everything. Can you do, person's private areas?
Yeah,
is that normal?
Absolutely. It's pretty common. It's one of our most requested areas.
So anything you can do, like with waxing, you can do with laser
pretty
hair?
much. Only thing with laser hair, we don't like to go underneath the eyebrow. It's very close to the eye, obviously, so we can go, right in between or above. Mm-hmm.
Okay. And who can get laser hair removal? Is it for everybody?
Typically everyone, it just depends on the pigment of your skin, pigment of the hair. So, if you are, the skin is typically, pretty much everyone, as long as you're not an active tanner, you're not using spray tan, things like that. But we do have lighter skin, darker skin lasers, so just about everyone can get laser. But for the hair, it's a little bit different. If they've got really red hair, blonde hair, white hair, it really doesn't work because there's no pigment in the hair to pick up. So we would do electrolysis for that.
So the laser actually targets the color in the hair, piece of hair?
Yes, yep, the melanin in the hair. So if there's nothing, if there's nothing for the laser to pick up, it just doesn't really work. So, you have to have at least, because we can actually do blonde as long as it's like a darker blonde for the contrast of the skin and the hair. So yeah, we do a test spot with Dr. Nanda first, and then I would just treat you after.
So someone would come in, get a consultation, do a test spot. Can they be treated that day after the test spot?
Yeah, as long as typically we say shave before. If you have a lot of hair, we'll either shave you if you really want it done that day. People will come back like the next day and shave. They can just get it done the same day as long as they, again, haven't been in the sun or taking antibiotics, things like that.
So you do need to shave before you come in. You don't have to have hair there for your laser to target?
Yeah, a little bit of stubble is okay. We do like to see, of course, the hair, but typically if you do shave, there's always a little bit of stubble that you can see, and he'll do a test spot, and if you're a little bit of pink, which is called clinical endpoint, it shows that we're really zapping that hair. So, if you want to grow your hair out a little bit, and that way we really get it, but like I said, it goes underneath the skin, so you don't really have to have it grown out. So. And
what kind of lasers do you use?
So we have Candela and we have Cynosure. So darker skin, lighter skin, they're both the same. We both have the same energy. They're just different manufacturers.
I gotcha. Mm-hmm. And when you do a treatment on someone, what happens like right after you? Is there a product they can purchase to? Is it hurt afterwards? Anything like that?
A little bit of pink, irritated skin, kind of like, almost like a sunburn or a rash. Nothing crazy. Sometimes patients get kind of itchy after, so we usually put aloe vera on. You can do mild lotion. We do have products in the office for calming, like post-laser balms, but typically an aloe is pretty easy to put on, and, they can ice it when they get home, so nothing, there's really not the crazy downtime. It sounds scarier than what it is, so. Yeah.
And you have to wear special eye protection when you're getting your treatment?
Yeah, we do have goggles. We have different wavelengths, so our goggles for like our lighter skin and darker skin. So if we do, a full face, we would do these really tiny, they're almost like old school tanning goggles they look like. So you put them on, that way you're nice and covered. And then if you're doing more full body or different areas other than the face, we just have they're kind of like sunglasses, so.
Mm-hmm. And it's springtime now, moving into summer. Mm-hmm. This is a popular time to get laser hair removal?
It is, but sometimes you burn the sun, which is obviously you want to enjoy your summer. So we're pretty busy in the spring. Summer we're not as busy, but we do have patients that really want it gone, and I totally understand. So they stay out of the sun. We get them in here and get them treated.
All right, great. This is Joe with Grandview Aesthetics and Plastic Surgery. You can call us at 614-421-7546 or visit our website at greatskinohio.com. Thanks a lot, Cassie.
Thanks.